Hello, this is Glenn W. Hunter, and with me today is Dr. James George from Excel Physical Therapy and Wellness in Redlands, California. Dr. George is a homeopath, functional medicine practitioner, and licensed physical therapist. And today we're going to talk about influenza. So, Dr. George, let's talk about the flu.
Hi. Hello, Mr. Hunter. Good morning. I'm very excited to share some information about influenza. Let's go right away with it.
Well, let's start with your specialty. Homeopathy provides its own way to successfully navigate the flu. What is it about homeopathy that specifically makes it effective in combating the flu?
We all know that homeopathy is a system of medicine which activates your body's immune function. It activates your body's healing mechanism. Now, what it does is when you take a homeopathic remedy, it stimulates your body's immune system, the WBCs, right, white blood corpuscles, to go and activate it and go and start attacking the infection. So typically, influenza is a viral infection. We know that. So when people have a kind of a depressed immune system, or the immune system is not as active because of pre-existing health conditions, so they are more prone for influenza causing them to be hospitalized. So homeopathy can help activate the immune system to heal the infection.
I see. So according to health.com, in their report in conjunction with the CDC, it says the flu has long been considered a dangerous seasonal scourge. New data on the COVID-19 epidemic underscore a frightening fact. COVID-19 is actually even deadlier. Common talk says influenza actually has more fatalities. Which is true?
Well, the data is still coming in. We know about COVID-19 started in September of 2019. The data is still coming in. The positive thing about influenza is there is vaccination for it, but because influenza virus is an RNA virus, it mutates almost every year, so they make new vaccines every year. COVID-19 doesn't have any vaccine yet. Having said that, still the flu vaccine has been effective about 30 to 45% the past couple of years. So 100 people they get flu shot, but 30 to 45 people are protected by it, but the others may still get the flu infection. But COVID-19 right now it is a mutated form of the cold virus, and there is no treatment and vaccine available. There is no vaccine available for COVID-19. It is dangerous, yes, but that doesn't mean that we should discount the fact that we all have an immune system to fight this viral infection. Just because there is no cure, just because there is no vaccine, we don't have to discount this fact. So people are fearful, are scared because, hey, there is no cure, there's no vaccine. But we have available information, taking certain supplements and taking homeopathy, we can activate our immune system to attack these viruses. Yes, so we need to consider that fact to be able to use our body's immune system to fight these infections.
Okay, so the tools are available. So switching gears a little, now we're entering the summer season here in the Inland Empire, and that means it's going to be hot. How does the weather impact influenza?
We all know that the typical influenza season is during the end of fall, start of winter, and through the winter, and almost through spring or start of spring. That's because people are not much exposed to the sun, And there are research studies which say that when people have low vitamin D3 in their body, they are more prone for viral infections. It includes influenza and any other viral infections. So during hot weather, if you tend to go out in the sun and get exposed to the sun, your skin produces vitamin D3, and vitamin D3 is known to activate the immune system to fight these infections. So that's the difference. But that doesn't mean that during hot weather, somebody cannot get a viral infection like a flu. The reason is if they still have poor immune function and if they have pre-existing health conditions, they are more prone for influenza infection.
Hmm. You know, what's really interesting, I think, in our culture when we talk about the flu is that there's an enormous amount of misconceptions about it. Um, what misconceptions about influenza do you commonly hear from your patients?
Well, one of those things is, hey, I took a flu shot, and they think that I'm a Superman. I'm not going to get influenza. That is not true. There are many people who have taken flu shots still have got a flu infection. What I'm trying to say is you need to still be careful. Wash your hands. It's very important, when somebody sneezes or somebody coughs, you need to make sure that you don't touch those surfaces or come in contact with that person. If so, wash your face and wash your hands. And so you need to take all the precautions, whether you're taking the shot or not. All right. So that's one thing I would say. And another thing is people uh, think that when somebody sneezes or have running nose, it is flu. But many of the allergy symptoms overlap with flu symptoms. The main difference between flu and allergies is fever. All right. And then many others actually overlap. For example, in allergies, you have sneezing, running nose, could have headache, sore throat, all these upper respiratory tract issues. So people could think that is flu. But flu is, there's a lot of body ache and fever. That's the main difference. So that will help us to not be scared of allergies, and allergies, you have itching eyes, watery eyes, so this is the difference.
You know, you're
And
talking about body.
also,
Oh, go ahead.
that's good.
So,
We go to
no,
the next question.
okay. So as you're talking about, the body aches and things like that, that just sort of take over, it makes you just feel miserable. There's still um, remedies that are out there. What is your approach to successfully treating influenza?
We should understand there is no, when somebody has influenza infection, medical doctors, they prescribe Tamiflu, to shorten the duration of the influenza infection. So you need to go see a medical doctor for that. But with homeopathy, what we could do is we can even improve your immune function, even prevent it from even getting contracted. Even if you get contracted by flu virus, your body can fight it. I have personally had a flu infection, and within a day or two, I am out of it because I have taken homeopathy in the past, and even if I get a flu infection, I take homeopathy. I know what to take, and I see results in a day or two. So yes, homeopathy is very helpful. You could also take certain supplements like echinacea, right? That could be helpful. And there are many other vitamins can also help. As we talked about vitamin D3, multivitamins can also help with activating your immune function, or even vitamins are kind of catalyst for your normal body function. And when they are available, your body does its job of fighting this infection. So it's all about keeping your immune system strong. by taking these supplements and also going with homeopathy. If you get contracted, if you have a flu infection, go see your primary doctor or go to an urgent care. They would give you Tamiflu or those medicines if only if needed for you. And but there is also another supplement called Theraflu. They have found that could also be helpful a little bit for some people. It all depends upon how well your immune system works.
Yeah. Again, a lot of tools, a lot of tactics to successfully treat influenza. May make you feel bad, but Dr. George is providing a lot of insight on how to overcome that and get back to enjoying life and being healthy. With all that information that you just shared, I know there's more you're keeping to yourself. Dr. George, how do we find you? How do people who are suffering find you for better healing?
Yes, we are. If you Google us, you can find us on Excel Physical Therapy and Wellness, and our website is excelrehabandwellness.com. You can also call us at 909-792-5050. For homeopathy consultation, we provide FaceTime, Skype calls, private Skype calls, even Zoom calls, and we could do consultation. You don't have to come to our office. And homeopathy consultation can be provided, and we, after an interview, we'll tell you what homeopathic remedy you need to take. Yes, give us a call at 909-792-5050 to set up an appointment. Thank you.
Indeed. And once again, I am Glenn W. Hunter. We also have Dr. James George of Excel Physical Therapy and Wellness. And he is in Redlands, California, and he is helping people every single day. So as you come through entering the summer season and you're not feeling top shelf, use this gentleman as a source for healthier choices and better living. Dr. George, thank you for what you contribute to the Inland Empire.
Thank you.
And